The meeting will begin in about 3 minutes. The meeting will begin in about 2 minutes. All right, Stuart, I have 2 o'clock. It's time for our program to begin. Our usual host, Tracy Stewart, has agreed to act as our moderator today. So, Stuart, jump in.
So, welcome everybody to our bi-weekly media questions where you can submit questions into the health department. The media can, and we also are streaming this live on YouTube, and you can ask questions on our YouTube live feed. Before we get started, I want to ask Sean to give us an update of what's going on with our COVID response and our cases in the district.
I'm just going to give some general totals here. We post this information each night on our website. In Adair County, we've had 15,080 total cases, 49 deaths, and we've released 1,494. Adair is in the red range of community spreads on the 7-day average, incidence rate average, which is 25 or more cases per 100,000 per day average. I think over the last few days, Adair is the only county we've had that's kind of dropped out of the red into the orange and back into the red, and they've been close. I think we've got one more county that's really, really close to dropping down in the orange. Casey County's had a total of 1,218 cases with 33 deaths and 1,150 released. They're in the red range of community spread, as well as all of our counties. Clinton, a total of 1,335 cases with 26 deaths, 1,263 released. Cumberland, 630 total, 8 deaths, 609 released. Green, 1,049 total, 13 deaths, 989 released. Macquarie, 1,655 total, 21 deaths, 1,530 released. Pulaski, 5,472 total cases, 79 deaths, 5,188 released. Russell, 1,583 total cases, 38 deaths, 1,427 released. Taylor, 2,524 cases, 29 deaths, 2,390 released. And in Wayne, 1,996 cases, 41 deaths, 1,903 released. District-wide, we've had 19,042 total cases, 337 deaths, and we've released 17,943 cases. District-wide, we have 64 presently in the hospital, 698 on home isolation, for a total of 762 active cases. We kind of keep a chart here in our operations center of how long it takes to reach 1,000 additional total cases. It took us 8 total days to get from 16,000 to 17,000 total cases in our district. That happened on January 22nd. It took us 9 days to get to from 17,000 to 18,000. That happened on 131. And it took 9 additional days to get from 18,000 to 19,000. That happened on February 9th. It was as short as gaining 1,000 cases. Was as short as 4 days back on January 8th. So since January 8th, the cases have been slowing down, as evidenced by how long it takes to add 1,000 total cases to our district. It seems like we've sort of plateaued. Some weeks we have ended with a somewhat fewer, and some weeks a little bit higher. But overall, over the last 2 weeks, it has gone down. So, you know, it's not going down as quickly as I would like, which makes me fear it might spike back up at some point. But I certainly hope that it either remains where it is or goes down quicker as far as their total number of cases. So that's where we are, sir.
Okay, thanks, Sean. So it is encouraging at least to hear that our numbers have plateaued and that we have had a downturn, even though not as quickly as what we would like. Dr. Wayman, for the first question, could you tell us what medical conditions will be covered? What medical conditions for getting the vaccine in Group 1C will be covered?
Okay, so per the CDC website, adults of any age with the following conditions have an increased risk of severe illness. So they are people with cancer, people with chronic kidney disease, COPD or chronic obstructive pulmonary disease, Down syndrome, heart conditions such as coronary artery disease or heart failure and cardiomyopathies, folks with immunocompromised, weakened immune systems due to organ transplantation, and obesity, a BMI of over 30 kg per meter squared or higher.
Oh, Dr. Wayman, and I know this question is going to be a little off the cuff. We've heard a lot about diabetes as one of the symptoms as far as being at increased risk. And I don't.
It is.
It is, yes.
There are various others. I assume this is just the tip of the iceberg, and I'm not sure what Kentucky's guidelines are. They may be a little different.
And if you click on our daily brief each day that we send out, at the very bottom of the page, there's a tile that you can click. I'm going to share that for a moment so we can all see it.
We may have inadvertently left it off this list.
So, you'll be seeing our I'm not sure if you're seeing it or not. I've lost my...
We see it, but...
Yeah, it's right down at the bottom, Sean.
Okay, so this is just our daily brief. You get to our daily brief if you go to our home page. When the page loads, it'll just be this first big tile you get, and it'll take you to our daily brief, which is where we list everything about case information and all the vaccine information for our district is there. And here's the updated vaccine information. You can click that, and it'll give you a larger view of it, and you can read all this. So there's a lot of things in addition that's shown there. So
I will point out, I did still see that smoking was on there, and smoking has been removed. So smoking would not be a medical condition for getting the vaccine in one group, in Group 1C.
It's still on there as far as the CDC guidance, but Kentucky's not going to use it.
Correct. Yes.
So that's the situation. And we should point out that right now we're in, as far as the vaccination phases, all the providers in Kentucky are supposed to still be in phases 1A and 1B, which is basically healthcare providers, nursing home and personal care providers and staff, first responders, school staff, and those 70 and older. And when we get on into the 1C group, it's going to be a very, 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 very large group. And if we think we have a shortage of vaccines so far, we've not seen anything yet. Because when it opens up into the 1C group, there will definitely be a tremendous amount more demand than there is supply. There's already just trying to get the 70-year-olds and older vaccinated, there's a supply issue. So the governor has announced, and the Commissioner of Public Health has announced, once we get to the point where we feel like the scheduling for the 70 and the older really slows down, then we've been encouraged to go to 60 and older. So it may be a while before we get fully into the 1C area. There is a logic, and I know some people will be upset that happens, but there is a logic to doing it that way. For the 70 and older, that represents 75% of our deaths, I think, and 50% of our hospitalizations. Am I saying that in reverse, Dr. Wayman?
No, I think you have it right.
I can look up on our website. But when you go to the 60 and under, it goes on to being 75% of our, 75% of our deaths and over 100% of hospitalizations. So, so the 60 and older group, you can move to the 70 and older, move to the 60 and older, you're really taking care of a lot of the hospitalization, a lot of the mortality. And a lot of the people that has been sending me information asking about when we will get to people with health conditions, a lot of them are in the 60 and older age group anyway, so we will probably catch a lot of those folks just by doing 60 and older. But I expect the governor is going to continue to push that message out across the state. So most of the providers will probably stick to that. So just keep that in mind as we move forward.
And by doing that, also, Sean, that it would be true that if we can keep those people out of the hospital, some of our younger people that have been in and have been treated and been able to get out, that leaves bed space. The fewer people that are in the hospital of the older people for COVID, more bed space is left for people with other diseases that would be entering into the hospital, or younger people who might have COVID that need to be in the hospital. So it is important to get our older population to make sure that they can be immune from COVID.
And just as a reminder, Stuart, we have some people listening in live. If anyone has a question that they want to ask, you can type it in the YouTube chat, and if we can answer it, we will.
Okay, Sean, I believe this next question will be for you. How are COVID-19 vaccinations being distributed in the Lake Cumberland Health Department's area?
That's a somewhat complicated question. I'm going to answer it two ways. I'm going to tell you everything I know about vaccine that's coming in their district, regardless of the provider. And then I'm going to tell you how we're distributing the vaccine that we're receiving in the health department. Because I'm not sure which question you're asking. Presently, we're getting 500 doses per week into our district through Lake Cumberland Regional Hospital, which is a regional hub, and they're scheduling anyone in the 1A or 1B group. I have some pretty good assurance there's going to be one or two more regional sites opening up within our King County district over the next 2 or 3 or 4 weeks. So that is being worked on. So that'll help. Through a contract directly with the federal government, there are going to be several pharmacies, and they're on our website on that daily brief page I just showed you, several pharmacies. They're going to be getting small pushes of vaccine each week, probably about 100 doses each. So that will help some. They will very likely stay in the same phases as everyone else. They'll probably be in 1A and 1B, and when they get to the point where they can go to 1C, it'll also be 60 and older first. The federal contract, Walgreens and CVS is doing vaccinations for nursing homes, staff, and residents. And my understanding is all of them have had at least their first doses. Many of them have had their second doses. And they're starting to work into the personal care homes. So that's happening. And then all of the school systems have had an opportunity to get a first dose vaccine as long as their staff signed up when they were asked to sign up. And we partnered with the Cumberland Medical Associates for Pulaski, Taylor Regional Hospital for Taylor, Kroger for Macquarie County, and the other 7 counties in our district was handled by Cumberland Family Medical. And they did a good job getting that accomplished, and the superintendents working to get everyone scheduled. That all went well. That was all public schools, private schools, Christian schools, anyone that wanted it. That's happened. And now we're working through the 70 and older group. So how's the health department? So everything that the health department has received up until this last push, the state decided which of our counties got it and how much those counties received. And we pretty much, when a push went into a county, we didn't move it from county to county. We left it in whatever county it arrived and administered it there, scheduled and administered it there. With this last push, we've been promised 4,000 doses over the next 3 weeks. 2,000 to come in this week and 1,000 each week after that for the next 3 weeks. And that was not distributed to each county. That was distributed to our district. And this is the first time we've had the choice at the district level here at the health department to decide how to push the vaccine out. How we did that was each county got a proportion of the vaccine relative to the proportion of that county's population to the total district population. So, for example, if your county represents 10% of the district's total population, you would have got 10% of that supply. That way, the larger counties aren't moving at a much slower pace than the smaller counties, and kind of keep everybody in line. So that's kind of how we pushed it. We'll continue to push it to make sure that every county is getting proportionally its fair share of what we're getting. So that's how we're doing it.
Okay, thanks, Sean. So this next question, Sean, this is for you also. And this person wanted to specifically ask about Wayne County. However, this is going to, I think your answer, you'll probably be able to touch on every county, at least in our district, because they say that they've heard that so many people who want to receive the vaccine, but they don't know how.
Well, it's not just Wayne County in that situation. All 10 counties in our district is in that same situation. All 120 counties in the state are in that same situation. And every state in our nation is in that same situation. There's not an abundance of vaccine anywhere. The companies that are producing the vaccine are trying to make enough vaccine for the entire planet. This is not, these vaccines just began to be developed and manufactured just a few months ago. It's not like a vaccine for a disease that's been around for many years, and the businesses know exactly what the demand will be each year and can produce what's needed. This is just getting ramped up, so there's a shortage everywhere. And when we get right now we've probably got 10 or 12,000 people in 1A or 1B before we scheduled these last 4,000 appointments that needed the vaccine, and you can only spread 4,000 doses across 4,000 people. And so that means there's several thousand people that's not going to get one of those appointments. So there's just no way to make that easy. I talk with not just me, many of the staff at the health department, talk with people all the time that's calling in saying, and they're telling us their story, that I've got this loved one that has this situation, and they're, it's sincere. They do have those difficult situations, but, and to that person calling in, their family member is their most prized possession. But their family member is no more important than any other person's family member. And, we just have to try the best we can to make sure everyone in a certain category has a fair chance to get an appointment. We can't pick and choose and cherry pick who's going to get on the list. When we open up the phone lines, everyone's got a chance to get it. And as frustrating as that is, that's probably the fairest way we know how to handle it.
Thanks, Sean. So, Ken, you've spoke about a list. Can you go a little bit more in depth about the list and what you've heard about the list? We had a question asking about getting on a list in Wayne County if there's any extra vaccine available. Of course, this question would apply to all 10 of our counties.
Several people have asked why we aren't keeping a waiting list. And for one, there is some promise now or some hope now that we're going to continue on into the future getting 1,000 doses pushed a week for our district. But up until I got that information a few minutes ago, we hadn't been promised any additional vaccine. And to keep a waiting list on nothing but a promise was not a great ideal. But there's other reasons not to keep a waiting list. The health departments across the state that have kept a waiting list, several of them have reported that their waiting list has grown to the tens of thousands of people. And whenever they get, a few hundred doses, maybe 100 doses for their county, and they got a waiting list of 10,000, that they'll schedule a clinic, and then you've got 9,900 people that's calling saying, I was on the list. Why didn't I get the appointment? Why didn't you call me? And then they keep calling in week after week saying, when am I going to get my appointment? When am I going to get my appointment? So, it's just an issue where you don't have enough supply for the demand, and keeping a waiting list, it hasn't seemed to help a whole lot. In fact, a lot of the health department, well, I don't know if a lot's right, but the ones I've talked to that's keeping a list have said they wish they hadn't started it because it's been more difficult. It's created more problems than it's resolved. I've also seen places that have done online scheduling and they've crashed their servers. If you've got a bunch of people in an area that wants the vaccine and you are able to roll up an online scheduling module, let's say you open it up at 9 o'clock in the morning, you have 100 slots, and those 100 slots on our online module can fill up in the first 2 or 3 minutes. And then everybody else is saying, I can't schedule an appointment. All the slots are full. Well, that's true, and so there's just no good and easy way to do this. And we will continue to evaluate and try to think of better ways to do it, but I can't make 100 doses spread over 1,000 people, regardless of how we do it. And, I just don't know what else to say about that. There's not going to be any easy way to do this.
Yeah, and I think we didn't want to, along with that, putting people on a list and then they feel like that they're definitely going to get it here. We want people to, if you can get it at Lake Cumberland Regional Hospital, if you can get in there, that's where you should get in there. If you can get in at the VA, if you're a veteran, get in there. If you can go to the horse park at Lexington, get in there. So we want, wherever you can get your vaccine at first, do that. Go on and get it.
Certainly up until this point, I feel very confident more of our citizens have gone out of our district to get the vaccine than we have had people come out of our district into our district to get the vaccine. Because really, we've only had the one regional site, that's Taylor Regional, getting 500 doses, and there's not going to be many people that's able to get one of those appointments from outside of
Lake Cumberland Regional.
Lake Cumberland Regional, what did I say?
Taylor Regional.
Lake Cumberland Regional. So we've benefited more from being able to go out of our county and out of our district, at least up until this point, than the other way around. So all of the counties in the state have an agreement not to turn away anyone who's a resident of Kentucky. And as I said, so far that's benefited our district more than it's hurt. We are supposed to start turning away out of state people because some folks, I think from Tennessee, were coming up in the bus load and was knocking out Kentucky residents. So it's a good one to put a stop on that.
So, Sean, can you go back over the populations that are currently eligible in the vaccine schedule?
Okay, so right now it's still 1A and 1B. 1A is nursing home, residents, patients, staff, and again, that's being handled by that federal contract with CVS and Walgreens, along with all medical staff. And the medical staff were largely taken care of during that first push. In 1B, you've got first responders, and they were largely taken care of in that first push. And you have school staff, who've now, in our district, largely been taken care of, and 70 and older. Well, anyone in 1A or 1B can, if you are in 1A, if you're a medical person who felt reluctant to take it, now you've changed your mind, you're welcome to try to call in and try to schedule an appointment. What we're not doing now is we're not going to prioritize medical staff or school staff over the 70 and older. I mean, everyone now in Group 1A and 1B has to compete. We're not going to fill off part of the supply and set it aside for any special group. It's just anyone in 1A or 1B.
And I suppose this question is a question that is, I guess, mainly for the health department. I suppose that's what they're asking is, do we anticipate receiving more vaccine in the near future?
When I answered this question, I said I hope so, but I've not been promised any at this point. We were just in a meeting a few minutes ago where it was implied that there would be some more vaccine coming, and following the meeting, I sent an email to the people that make that decision just to verify if that's true and what amount that will be. So once we verify that, we'll put it in our daily brief so folks can know.
Yeah, and again, we do know that some pharmacies will be getting that here in the near future. So that's a good thing that we'll be seeing some more vaccine come into our communities. Dr. Wayman, what's the best source for vaccine information in this area?
Well, we have a bunch of links that are on our piece of paper, which obviously you can't see, but you can find them on our website. And that's at either the CDC, or you mean for our area, that's Kentucky.
Yeah, so for
Kentucky COVID vaccine.
I think for our area, you can go to LCDHD. We do keep that on there. And then, of course, if you need just general vaccination information, you can look at the CDC's web page, and there'll be just information about the vaccine itself, also on covid19.ky.gov and on govstatus.egov.com for the KY COVID vaccine. You can look at any of those. There's a number of websites. You can just Google COVID information probably and be inundated with information on COVID. So there'll be plenty of places out there. Sean, if a vaccine does become available, or if vaccine doses become available in a county other than where a person lives, it is perfectly acceptable to get vaccinated there. That's a question. And in other words, there are no requirements to live in the county that the dose has been allocated for. So you've kind of answered this just a minute ago, but go back over that again.
That's correct. I mean,
And every county in the state has agreed not to turn away a county resident. And while, I've talked with different people in leadership positions in the county that feels like that's cheating their residents, I feel very confident that that rule has benefited the citizens of Lake Cumberland much more than it has hurt them. Like I said, up until this point, the only consistent supply of vaccine was coming into Lake Cumberland Regional, and that was 500 doses a week. So, the people that were getting it were mostly the 70-year-olds, the ones that weren't in a designated like school staff or medical staff. They were traveling out of our district to get it. And I've not done the data on this, but I really believe we've had a whole lot more people go out to get it than come in. So that's benefited us. Now, if people are a whole lot more likely to go out to these regional hubs than they are to come into the little clinics. So I think that will continue to help. When I say regional hubs, I'm talking about the big ones like Lexington and Louisville and so forth. Anyway, but overall, the state, I believe, is going to try to do the best they can to keep each county as closely in the same phase as possible. It won't be perfect, because since the vaccine, I think Moderna comes in shipments of a minimum of 100. And I think Pfizer, which we're not dealing with, but it comes in a much larger shipment, 900 and something doses. So if you're a really, really, really small population county and you're getting
issues of
100, you're going to get through whatever phase you're in much quicker than if you're a county getting 100 and you have 4 times that population. It's just so the counties will get out of the phase. It won't stay comparable, but the state's going to try to keep it as even as they can.
So everybody, be sure and go in if you have questions, go into our chat feature on YouTube and type your questions in. We'll answer those. This is the last question we have submitted today, but I think that we're probably going to go over a few things that have happened this week that we'd like to talk about, our own clinics and the things that are happening currently, also with the weather situation and things like that. So, Dr. Wayman, if I took the second dose of the vaccine and got COVID shortly after, am I able to get the second dose on time, or do I need to wait 3 months?
Okay, so you are able to get the second dose after you have been released from isolation and recovered. However, when you have COVID infection, you mount an immune response. And many people who have received the second dose too close to their infection had severe immune side effects, fevers, body aches, chills, headaches. So my recommendation is to wait a few months, 2 to 3 months after your illness. But it is your choice. You can have it as soon as you've recovered.
And I would recommend for anybody listening out there to take Dr. Wayman's advice. I will say she's probably one of the most knowledgeable people on COVID in our district and in our state, and to me, in the world. So she knows what she's talking about. We do.
She may be the biggest expert anywhere in the universe.
Right. She's pretty much she's a pretty expert person. We do have a question.
Not quite, Stuart. However, we've had a lot of our own people who received the vaccine a little bit too early.
Right.
They had these side effects.
Right.
We're talking from experience.
We're talking from experience. That's right. I know a guy really well named Stuart Spillman who had that happen to him. So I would recommend that you wait a little bit also on that, because you have such an immune response going that it does make you feel really bad. We have a question in the chat from Charlie Van Leuven. I hope I said that right. So I think this is for Sean. He said, how did it feel getting to close on Sunday for the first time in months? And does it seem like to the health department that the worst of this pandemic might finally be over?
Well, as far as, we tried to hire enough people, and there was a point in time when the surge was growing much faster than we could hire people. So we were really, really, really stretched thin, and it got to be where hiring people was a problem because we were running out of space to place people safely in our buildings. So, it was getting to the point where we were getting very overwhelmed. But other than a fairly short period of time, we tried to rotate most of our staff where they get some days off each week. Sometimes they have to work long days or weekend. Well, everybody has to work some weekends, but there are a handful of us who haven't had 2 or 3 days off since March. And so to have started having Sundays off, is awesome. It was my first full day off since, I guess Christmas was the only other day I had totally off. So yeah, it was neat. I didn't know what to do with myself. Felt like I ought to be working, but
I tried
to rest a little bit. Does it feel like we're the worst of it? I hope so. You never know with this disease. We've had peaks and valleys. If you look at our trend chart historically, and are we going to have another peak? I hope not. I hope we're getting to where we've had over 19,000 of our 200,000 citizens, so we're getting close to, when you get to 20,000, you're getting close to 10% of our population having had COVID, and now we're getting the vaccine out too. So, hopefully the combination between people having had it develop some sort of immunity and the vaccine getting out, maybe it's naturally starting to slow. Maybe, with people still social distancing and masking, that's helping. All those things together. We certainly want it to slow because, the vaccine is coming into our district now. And I know people feel like it's been, we really need to be doing more with this vaccine, but you got to remember, we had our first case in March. The vaccine was developed and approved in less than a year. And just the week before Christmas, that's just a few weeks ago, we just started getting doses in our district. Since the week before Christmas, all of the medical providers in our area that wanted it have been vaccinated. Hospital staff, personal care home residents and staff have had it. School staff have had it. First responders have had it. And we're probably getting pretty close to half of the 70 and older population having had the vaccine. So, it's really moved much quicker than what people think if you can step back and look at it. Now, I know it don't feel like it's moving fast enough if you're one of the persons who's trying to call for an appointment the last couple of weeks and couldn't get one. It don't feel like it's moving very fast. But from a high view perspective looking down on it, it's moved pretty quick. And, we're adding sites into our district each week and some more vaccines becoming available each week. So, if too much has been allocated to the nursing homes, some of that's rolling back in. The federal government, there's more production by these companies and more is getting pushed into the state. So, we'll get through this. If we don't devour ourselves or each other in the meantime, we will get through this. So I see a couple more questions.
Yeah, I've read over these. Daniel Johnson has submitted some questions, and what I want to do is use Daniel's questions to segue into another section. As you know, we've received 4,000 doses for the course of the next 3 weeks. We scheduled those starting Monday. Done some more scheduling yesterday, and we just had a little bit of cleanup to do today to schedule those appointments. So, and we did those by phone. And Daniel asked that we're seeing other communities that are bigger, like Lexington, Louisville, and Owensboro, using online appointment scheduling and even smaller counties like Floyd are doing this. So, Sean, can you just talk about?
It's every county has to make a choice how they're going to handle it. And we've got a push of 700 doses and scheduled 700 doses in 2.5 hours. And we got all of those doses administered within 2 days. We got a push of 4,000 doses and scheduled essentially all of those appointments within 2 days. So, to me, that's pretty successful. Now, I know if you called and waited on the phone, that wasn't successful, but when you have these online scheduling systems and you have a limited supply of vaccines, when the calendar goes up to get an appointment, providing the servers don't crash from having too many hits in the first few minutes that it's open, then the available appointments fill up within just a few minutes. And then everyone's upset because the scheduling is closed. So, there's different ways to do it. Anyway, for the 70 and older population, it was our feeling that with the technology barrier for the elderly, it wasn't a wise idea, regardless, to use online scheduling or anything like that. After we get through the 60 and older age group, when we get into the larger population, looking to some sort of vendor or online module or a scheduling agency or something to handle the big group when we get past the 70 and older, 60 and older, we may do that. We may well do that. So it'll be something. But there's no perfect solution to doing this. It's always frustrating because there's just not enough. I mean, if we had an unlimited amount of vaccine and an unlimited amount of staff, we would hire, or purchase whatever product was necessary to deal with that. But the problem is that there's just not enough supply, and there's way more demand. And then keeping waiting lists, places that's kept waiting lists, the waiting lists have grown to tens of thousands of people on their waiting list. That has not proven to be helpful. And so, I do understand, I'm aware of the technology, Daniel, and that is out there. We haven't so far gotten to a place where we feel like it's the right time to look at using some of that. So, like I said, every district has to make its own decisions how to handle that. And so far, with the 7 older group, we just felt like phone in was the right thing to do. Now, it don't feel great, I guess, when you sit and try to dial in for 2 hours and you don't get an appointment. That don't feel awesome. We did schedule 700, and then we scheduled 4,000 more. So, we're doing the best we can.
So, thank you, Daniel, for that question. Also, just talking about this week, Sean, we did run into some difficulties in our scheduling that was unforeseen, and sometimes things just happen that's out of your control. Spectrum, our internet provider, went down in Pulaski County and in Casey County, and our phones are voice over IP, so they're through the internet system. That causes a problem. That actually is a problem that we really couldn't help that one. That was out of our hands, but it did end up causing us a bit of a problem, and we apologize for the issues that caused. And now this week it seems like the weather's not going to cooperate with us for our clinics that we had scheduled for the next couple of days.
So let me, on both of those issues, Stuart, fortunately, Spectrum is not the only internet service provider in our district. So some of our outlying counties still had internet access. So we were fortunately able yesterday to reroute our calls to the counties that still had service, and they were able to go ahead and schedule appointments. It was, I guess, just a twist of the fortune that the system stayed up enough to where we could push it out. If we had an inter-based system, scheduling system yesterday on our server, it would have been down for the entire day because our service provider for the county that hosts our web servers was down. So at least we were able to still do some scheduling yesterday. If in case you're listening in and you don't know, there's supposed to be an ice storm that's coming in. We had COVID clinics scheduled for tomorrow and Friday. We have reached out to already, or in the process of reaching out to everyone that was scheduled for Thursday and Friday. We're scheduling them to early next week. Fortunately, we were able to do that we were able to get them worked in early next week. So that is happening. But if you haven't gotten the information, I think we're posting something on our website, or maybe you already have, that talks about what day your appointment will be on. I won't try to remember all that off the top of my head, but it is posted out there. Amy, has that been posted? She's listening to another meeting.
So if it hasn't, it will be soon. That we'll post when those have been rescheduled to. And we also know that everybody that was scheduled, for the most part, unless there may be a few they weren't able to get a hold of, but they have called all day long to make sure that those people that are on a Thursday or Friday clinic, that they know that they've been rescheduled to another day. I think people are quite happy with that. We don't know we just can't predict exactly what kind of weather we're going to have. I mean, it could miss half of our counties. It could hit us all with, we could just all be stuck at home. I don't know. So
about the online scheduling platforms, one thing to remember is, and I'm not sure about this, I've heard about the program that UK has or has developed or whatever, but a lot of these online scheduling platforms were not designed for super mass scheduling. They were designed for regular day-to-day clinic scheduling. And what I mean by that is, if you have 1,000 people on your website all at once clicking on the same appointment slot, that it can overwhelm the software that's running behind the scenes, and it doesn't know how to deal with that many people competing for the same appointment slot. And sometimes it'll either just crash, or it will double book, or it will not book anyone in that slot, or it'll give people false appointments. So, you got to be really careful when you get into these online scheduling things to make sure you've got something that's designed for a mass scheduling event. So that's something that, we would want to see how it has unfolded in some other locations and make sure it's equipped to handle the volume before we move into that.
So that we don't have any more questions, so we're going to give just a couple of minutes for people, if they do have more questions, to type it into the live chat. As we're doing that, I wanted to ask Sean, we had a big surge of calls, and do you remember what that surge was? I think we talked about it this morning. I believe it was, we had a surge of 300,000 at one time that our IT people had said, and then our callers we did have over 300,000 calls on Monday. Now, some of those, when I say calls, dial-ins, some of those were the same person dialing over and over again, the same number. But it was a tremendous amount of dial-ins for 4,000 vaccines.
And we expanded our phone capacity to 30 phones, and we had I think roughly 20 operators working that day. So 30 operators or 30 phone lines and 20 operators for 4,000 doses, that should be sufficient, for them to. I mean, they were taking calls one after the other, and they could have scheduled most of the day, but still, when you're getting 300,000 calls, 30 lines is not enough.
Yeah, and one thing I think Daniel Johnson had pointed out here, he was talking about that this system apparently that UK has designed, it's actually designed to handle 100,000 requests a minute. So that one can actually take in a lot of requests. As we say, though, we had decided, at least for these 70-year-olds, to go with the telephone dial-in, let them speak to a live person, and be able to get their appointment. Also, Sean, I did want to touch on another thing that was a question that had been coming in to us. Why did we decide to do a call center in Pulaski County and have all the calls routed in for our initial call center instead of letting each county? And would it have made a difference with that many calls in? Would it have made a difference whether they were coming into one call center or if they were spread out throughout the whole 10 counties?
It wouldn't have mattered. As long, we had a limit of 30 lines and 20 operators. It didn't matter where they were stationed. They could have been, 2 operators in every county and, 10 extra ones spread out here and there. There's still just 30 phone lines and 20 operators. And they were all having access to the same scheduling system, a live interactive scheduling system with the days programmed in and the number of slots for each county. And, everyone was scheduling for all of these slots. So no, it wouldn't have made any difference where the calls were going in at. It's just 30 operators or 30 phone lines, 20 operators, and a schedule program. So no, that wouldn't have made a difference. Let's see. Daniel said a comment about mass scheduling isn't true. They are designed to handle 100,000 requests from it. Dan, either I wasn't clear in what I said or you misunderstood what I said. The UK system probably will handle that demand. What I said is you have to be careful when you're looking at one of these online scheduling programs. They are not all designed to handle that volume. And just because the software is designed to handle that volume doesn't necessarily mean that your particular internet speed or your particular servers are set up for that. There's a lot of ways you can set these up. You can go through an outside vendor and use their connections and their servers and their software, or you can try to purchase your own and load it onto your own system. So what I'm saying is there's a lot of things you have to take into account when you're setting one of these things up. So perhaps the UK option that we're talking about would be the way to go. I don't know. I've not fully evaluated that. It would. We're still a little ways off before we get through the 70 and older group and the 60 and older group to even open that up really for consideration. We will, if we do it, we will research it and try to do it right. So I appreciate the comment. We will try to get it right once we go that route.
So I don't see any other comments on our chat. Sean, do you have closing comments you'd like to make?
Well, there's still a long ways to go with this. And when I say a long ways to go, we're not as far away from getting to the end of this as we were back when this started in March. It does feel like the case volume is slowing. The thing I fear is that people will lose their vigilance to being cautious as they feel, if they start seeing the numbers drop and hear that people are getting vaccinated, they'll let their guard down and start getting out in crowds more and not wearing their masks and having more home gatherings and things. And with this disease, and particularly with the new strains that are more contagious, you don't want to give this thing a chance. You don't want to give this thing a chance to take back off again. Let's keep our positive momentum. If it's your turn to get a vaccine and you can get an appointment, please get it. And up until the vaccine is widely available, let's continue to observe the precautions and try to keep things slowed down until we truly have, more of a herd immunity and can say, hey, we feel like this is behind us. So hopefully by the end of hopefully by the first of summer, we will be through, probably before that, probably quite a bit before that, through the 70 and older, and maybe into the summer getting through with the 60 and older, maybe quicker than that. I mean, that'll be a big important step getting through those groups. So, but anyway, until the vaccine's widely available, we would encourage you to take precautions. Anything else anybody else wants to say, Dr. Wayne?
Dr. Wayman?
That's exactly what I was going to say, so thank you.
I should
Take
let you say
precautions,
that.
because the more infections there are, the more mutations happen. It's like retyping something and making mistakes. So the more you type, the more mistakes you make.
Now,
The virus wants to survive. It's Mother Nature. The virus wants to survive. It wants to mutate and live on. So, the more that we allow this thing to spread and not take the precautions and hold it at bay, the more chance we're giving it to mutate and exceed the ability of the vaccine. So you do want to be cautious. And we don't want this thing to get away from us again. So take the precautions.
Yeah. So everybody, thanks for joining us. Just remember as we close, don't be afraid of the vaccine. Get the vaccine when you get a chance. Please get the vaccine. That is what is going to bring us back to some sense of normalcy. So if you want to go back to doing the things that you done in 2019 and the things that we're all used to doing, get your vaccine. Also, don't forget to get your flu shots. So be sure and do that. Our next media call will be on February the 24th at 2 p.m. Eastern Time. So media, please be sure and submit your questions to us. You can submit questions to us via Facebook, our page, and tune in and you can submit questions to us on our live chat. So we will see you on the 24th. Thanks a lot.
Thank you all for joining in.